Good evening, everyone. I'm going to continue where Dr. Deepanjali has left. She has talked about the BID versus the single dose for a small cell lung cancer radical radiotherapy. Now, this was a comparison of quality of life for patients randomized to this two groups. So we all know that CLGB 30610 trial 70 gray once a day versus the 45 gray BID was used, and the overall survival was similar for both the groups. But since both groups appeared to provide similar clinical benefits, other factors such as quality of life may help oncologists to decide which is the best approach. What they did in this study was they had a questionnaire, FACT L, FACT Trial Outcome Index, which is FACT LTOI, FACT Esophageal Cancer Eating and Swallowing Indices, ECOG Acute Esophagitis Scale, Hospital Anxiety and Depression Scale, which is HADS, EQ5D, and a single item assessing difficulty in swallowing. Time points were baseline at 3, 5, 7, 12, 26 and 52 weeks after starting the radiation therapy. Assesses treatment inconvenience at this time points. Primary endpoints were FACT L, TOI, and FACT Eating and Swallowing subscales at 12 weeks. Mean changes from baseline were compared between arms using general linear mixed models. So they had 417 patients consented to participate in the patient-reported outcomes sub-study. The completion rate of the questionnaire was 87% at the baseline and 71% at the week 52. In the CALGB 30610, there were 646 patients. 417 patients consented to participate in this study. Baseline PROs were 364 patients. 342 patients at least one follow-up PRO. 340 patient baseline and at least one follow-up PRO. The completion rate of the questionnaire was 87 at the baseline and 71 at week 52. And as you can see in this, the data, almost everything was similar. As you can see, it was similar in both the groups. Like if you consider the 45 gray twice a day or 70 gray single day, the male-female ratio was similar. Majority of the patients were whites. And the ECOG was either 0 or 1 for all of the patients. Now let's come to the results. The FACT-L total score mean worsening was significantly less in the once day arm at week 3. As you can see here in this chart, this was the once a day and this was the twice a day group. So at 3 weeks, if you compare, if you see here, it was better with the once a day radiotherapy arm. And I think I don't know whether it is visible or not, but this was the physical well-being, this was social and family well-being, this was emotional well-being. Again, if you compare at 3 weeks, it was better with the once a day arm. So FACT L TOI mean worsening, less in the QD arm at week 3, greater in the QD arm at week 12. So whatever was there at the 3 weeks, at 12 weeks, it significantly changed. The 45 gray BID arm was better at week 12. They were worse at week 3, but they were better at week 12. This was the esophagitis arm. Fact E changes. Again, it was better in the QD arm at week 52. When they reached week 52, it was better in the once a day arm. Acute esophagitis score was worse in the BID arm at week 3. So patients who received 45 gray twice a day, 1.5 gray twice a day, had more reactions at week 3 compared to single day. And when they reached the 12-week group, it was better with the twice a day group, because the esophagitis occurred earlier in the twice a day group and then it gradually improved at 12 weeks. Again, similar in the difficulty in swallowing group. Again, it was exactly the same. It was better at 3 weeks for the BID arm, and at 12 weeks, it was better for the once a day arm. EQ5D. The EQ5D was mentioning the 5 dimensions, including the mobility of the patient, self-care, usual activities, pain, discomfort, and anxiety and depression. It was a lesser worsening in the QD arm at 3 weeks, as you can see here. The anxiety score, again, it was less in the QD arm, which was once a day arm, at week 5. As you can see here, it was better at week 5. Now, if you see the convenience for the patients, the 45 gray arm, which was the BID arm versus the 70 gray arm, the convenience was 67% felt it was convenient for them, whereas in a single day radiotherapy arm, almost 74.5% patient felt that they are convenient with this kind of treatment, and this was again divided into 4, but this was a summary that majority of the patient felt that 70 gray arm was better, where you give a single day fraction. So in the conclusion, what they concluded was both single day radiotherapy and twice a day radiotherapy regimens were well tolerated. The single day radiotherapy had better quality of life scores at 3 weeks because the side effects were yet to start. In the twice day radiotherapy arm, the side effects are already started at 3 weeks, but it was worse at 12 weeks. And the single day radiotherapy arm was perceived to be less inconvenient. In my routine practice, I practice single day radiotherapy. But yeah, everybody practices differently. Maybe Dr. Kannan can make a comment like what he practices in Hinduja. So this was my last slide. Thank you so much. Kannan sir, what do you practice for small cell?
For the past 20 years, we have just treated 5 patients. All were BID regimens.
BID regimens.
All were BID.
Okay. So sir practices BID, I practice single fraction a day. So majority of the times, it is all equal as far as the outcome is concerned and as far as the convenience of the patient is concerned. Thank you so much.